Welcome everybody. I think we have folks joining. It is 11:01, so I'm going to go ahead and get started. So again, welcome to this information session offered by the Department of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. My name is Sally Safi, and I'm the Director of Graduate Studies in the department. We are really excited that you have joined us today to learn about our department, the programs we offer, and how our students are engaged in work with our faculty. Just to go through what the session will be today, I'm going to give a very brief introduction about the department and the school, and then we'll spend the bulk of our time together today hearing from current students and faculty about their research. We'll discuss projects on which they collaborate and give you a sense of the opportunities beyond the classroom that are available to students here. After we hear from our student faculty pairs, the education team, including myself, will stay on and share information about our degree programs, including our Master of Science in Public Health, or MSPH program, and our Accelerated Bachelor's MSPH program that is available to Johns Hopkins undergraduates. So please feel free to ask questions at any point during the session. You can drop them into the chat, or if you want to raise your hand and come off of mute, that's totally fine as well. So first, a little bit of background about the Department of Population, Family, and Reproductive Health, or PFRH. We are one of 10 departments at the School of Public Health here at Johns Hopkins. The department has a long and rich history. Decades ago, the Department of Population Dynamics merged with the Department of Maternal and Child Health, and we became the Department of Population, Family, and Reproductive Health. The work of the department is diverse, but we are united in our focus on promoting health and well-being across the life course. We use a multi-level life course framework to understand public health issues and the interplay of biological, behavioral, societal, and other factors across a person's life and across generations. And this framework helps us to advance health equity through effective public health research and practice. So I know population, family, and reproductive health is a little bit of a mouthful, but to give you more of an idea of the work that happens in the department, students who come to the department select an area of interest, and this allows them to drill down in your focus area. So these 4 areas are shown here on the screen. And in practice, there's actually a lot of overlap in these areas. So courses we offer might fall into multiple categories, and faculty work often does not fit neatly into just one of these boxes. But rather than constrain students, these areas are really meant to help guide you when you're here in selecting courses and refining your interests as you're studying public health. So today we're going to focus on projects that might most closely align with women's sexual and reproductive health, but I suspect we'll see themes from other areas in what we discuss. And as I just mentioned, PFRH students delve into their areas of interest through coursework, as well as through opportunities outside of the classroom, including by working with various centers and initiatives that are housed in the department. So these centers and initiatives bring together faculty, staff, and students from PFRH, other departments in the school, and divisions across Hopkins, as well as the broader community. So you can visit the PFRH website to explore the various centers, but today we're really pleased to showcase one particular center led by Dr. Michelle Decker. So Dr. Decker, I'm going to pass it over to you to talk about the Center for Global Women's Health and Gender Equity, and just let me know how I should advance slides.
Wonderful. Thank you so much. Sally, thanks for organizing the session. And I'm just delighted to have an opportunity to talk about the center and how it fits in with PFRH and share some of the work that we've been doing. So this is our introductory slide, and I'm delighted to tell you, next slide, please. Just a little bit of background on gender equity. We're at a very interesting moment in time on this. And one of the landmark events that we usually really refer to is the Beijing Declaration and Platform for Action from the mid-1990s, kind of a really watershed time period for women's health globally and here in the United States. And since that time, here we are celebrating Beijing plus 30. And since that time, we've seen a number of tremendous advances in women's health and rights, gender equity. And we still have a lot of work still to do. And we see that enshrined in the Sustainable Development Goals, number 5 on gender equity and empowerment for women and girls. And you see a few of the tools that we really use a lot at the center on ethical frameworks for gender equity and GBV work, gender-based violence work, as well as some of the tools. And the graph that you see there is showing the number of hits and the sort of the evidence base accelerating over this period. So next slide. This is a big focal point for our work. And then when we bring this to public health and population, family, and reproductive health, we're really talking about framing gender equity and global women's health, looking at gendered systems at the macro policy level, looking at social normative factors in the environment, gender norms, relationship norms. Coming into that interpersonal sphere is factors at the relationship level and the family level. And then you've got those individual factors that are usually sort of that innermost circle. And as well, when we layer that in and we think about biology, positionality, intersectional frameworks, this is sort of a very holistic lens that we take to looking at gender equity and global women's health. Laying this out, not for you to absorb all of it in this moment, but just to orient you to a few of the frameworks that we really use in this space. Next slide. And then our center was established just recently in 2023 with the goal of advancing global women's health and gender equity through action-oriented research, training, and translation. We are truly global, meaning that we have US-facing work as well as partnerships around the world. And some of our priority areas are around eliminating gender-based violence and other harmful practices, powering women and girls in the economic, social, and political spheres that shape their lives, and strengthening health systems to optimize gender equity. Next slide. Some of the courses that are most aligned with the center that I wanted to highlight as part of this session are actually a fourth term course that we have running right now, International Perspectives on Women, Gender, and Health. We have a gender analysis course that's offered through our counterparts in international health on gender analysis within health research and interventions. And we also run a gender-based violence course and a women's health course in the third term. And these are really sort of the breadth and the depth of the training in women's health and gender equity is one of the reasons that I think population, family, and reproductive health is quite so exciting and enriching for this type of environment. Next slide. For those that are interested, I wanted to flag as well, we have a summer institute, a gender and health summer institute that we participate in. So this is short courses, short course offerings for many of our term time courses. We always like to let people know about this. You can take a look online for that. And then next slide. One of the things that we've been able to do through the center, we have a gender and health certificate program for people that want to be able to package this training. And that's an offering for enrolled students. And then next slide is our Student Experience Award. And this is something that we've been able to offer through the center really for experiential learning, support for events or projects that are related to our priority areas. And it's an application based. They're small, relatively small award sizes, but they allow people to go to conferences to present posters and share some of their work, as well as other types of experiential learning to really deepen what they're getting in the classroom. One of the things we've been really excited to offer through the center. Next slide. Just highlighting a couple of our awardees, and you can follow us. Thank you. Salama's put in the chat some of the links to the center. We just wanted to give you a little bit of a taste of our current, more recent student experience awardees. I want to make sure we have enough time for the discussion, so let's keep moving. And then our last piece is, again, just sort of a touch point on the center's really diverse portfolio of applied research. You're going to hear a little bit more of this today in a deep dive through the later conversations. So a couple of the areas that we're very active in are around gender equity and gender-based violence metrics and evidence for action. So survey research, applied survey research, measurement and metrics for emergent forms of gender inequity in GBV. This is through some of our work with the Bill and Melinda Gates Foundation. And these are kind of elements like stigma, menstrual hygiene barriers, time poverty, economic abuse, tech-facilitated violence, areas that we know are up and coming and really critical to study, but we're really advancing both our knowledge of the scope of these issues as well as how to do this work well. And you'll be hearing about our Agile study, which is a mixed methods multi-site piece in Kenya with a diverse partnership. Another example in this area is also really quantifying, for example, the interface of economic power and violence against women. This is some work that we have underway through the What Works initiative through FCDO. And then we also have sort of an intervention lens element, preventing violence against women, mitigating the impact of gender inequity. You'll be hearing a little bit today about some of our work through Dr. Holiday Norwu on interrupting perpetration. We also have elements that are touching on environmental and situational prevention, for example, sexual violence on college campuses, tech-based supports, reproductive coercion, housing solutions, and then our policy implementation element around the National Plan to End Gender-Based Violence. So again, sharing just to kind of give you an orientation to the breadth and the depth of the work that is underway within this topical area within the department. And throughout all of this work, we embed master's and dissertation work and really engage students wherever they are in their training to really, again, tighten the link between the classroom and the applied learning. So thanks. I think that is our last slide here. And thank you for the opportunity to share this. I'm going to turn us back over to Sally for the next portion of our agenda.
Great. Thank you. Thank you so much, Dr. Decker. So I hope that gives you a good overview of the department and then this one center in the department where all of our panelists today are joining us from. So like I said, at about 12:40, we'll turn to discussion of PFRH programs and the application process. So we'll get to all of that in a little bit. But right now, I want to turn the discussion to our students and faculty. So I'm going to stop sharing my screen. And so that we can all appear together here on our Zoom panel. And I am going to, I'm just delighted to welcome Olivia Coffey and again, Dr. Michelle Decker. And so to kick off our discussion, would you both mind just introducing yourselves a little bit more and sharing a bit about your public health interest and experience?
Sure. I'll give you the sort of the intro specific to this topic, and yeah, my role in the work that we've really had the deep pleasure of having Olivia participate in as a master's student. Again, this is our Agile 2.0 gender-based violence and gender equity metrics work. And it is blending multi-site survey research on a variety of gender equity topics in Kenya alongside, it's a mixed methods element. So we've been able to embed focus groups and interviews throughout to really for the purpose of understanding the scope and impact of violence, especially newer forms, and really with a lens towards what do we need to be doing better to prevent violence or mitigate the health impact. And I came into public health as a former sexual violence victim advocate. So this work is really near and dear to my heart and is part of the motivation for the focus of the Agile project. And it's been such a treat to work with Olivia on this. So I'm going to pass it over to you.
Yeah, thank you for that introduction. My name is Olivia. I'm a second year MS-PH student in PopFam. My concentration area is in the women's sexual and reproductive health area. I am primarily interested in gender-based violence and its impact on sexual and reproductive health outcomes. I had the pleasure of working with Dr. Decker on this project. My main role has been doing qualitative analysis, looking at the different barriers to help seeking, understanding economic abuse, and I then dovetailed that work into my master's essay, where I'm writing about the analysis I've done focusing on barriers to help seeking. So it's been a really great opportunity to take what I've learned in classes to apply it to subject areas that I'm really passionate about.
Thanks so much. Do you want to talk a little bit more about maybe just one component of all of, I know it's a broad umbrella and you're doing a lot of different work, but could you maybe drill down to like one research question and some preliminary findings, if you don't mind?
Yeah, I can talk about my master's essay because that's, I feel like, what I'm in the weeds of right now. My question is understanding the barriers to help seeking for Kenyan women experiencing intimate partner violence. So some findings are, we're still in the process of working out my paper, but we're seeing a lot of individual level factors like economic dependence on their partner. Community level factors like cultural norms are also a major barrier survivors are facing to seeking help, things like that.
Thanks. And so what, and this question could be for either of you, what do you really hope the public health impact is of this work, whether it's your master's essay specifically or the broader work? What is the impact that you're hoping to have?
I would say I can only speak to the qualitative piece of this study, but I think understanding like the cultural nuances in this specific region are important for developing interventions to help survivors, I would say is the biggest impact I would hope to see coming from this. And like understanding the barriers to help seeking are important so that interventions can address those barriers. So, because if we have services and people can't get to them, then we can't help survivors.
Thanks. Dr. Decker, do you want to add anything?
Just one thing that has been especially fantastic about this, and to having the opportunity to have Olivia be part of the study and also use her master's to delve into this more deeply is, just about a year ago, having the pleasure of having you in the third term course, specifically focused on GBV, where we're looking at, different examples from around the world, key frameworks, where are we on metrics and public health prevention and response, and then had the opportunity to have you embed within Agile for this broader study on qualitative coding and analysis, building the method skills, and then being able to kind of bring this together and hone in on a focus for the master's essay that brings your methods training from, PopFam and from School of Public Health, along with the substantive pieces, and is actually like a deliverable and a core part of what we're doing for the project. This is exactly always what we're kind of hoping for on the teaching and training side, and what we're really trying to build and bring together for our students. And to me, this is just such an amazing example of how all those pieces are layering together over the 2-year master's program. So I just wanted to give that reflection on that as well.
Thank you so much. Thanks both for sharing just a few minutes about your work. I know that we could continue this conversation for a long time, but really appreciate you sharing all of that. And I'll circle back to one final question for both of you in about 10 minutes or so. But for right now, I want to turn to our other pair of presenters. So we are just delighted to be joined by a student, Chidera Eja, as well as Dr. Sharvon Holiday-Waru. Can I pass it over to both of you to introduce yourselves a bit and tell us a little bit about your public health interests and expertise?
Sure. Thank you so much, Sally. And thank you all for joining us today. It's so great to have you in this brief informational session. My name is Sharvon Holiday-Waru. I am currently an assistant professor in the Department of Population, Family, and Reproductive Health. I had the pleasure of completing my postdoc with Dr. Michelle Decker and then transitioned on to faculty. My research focuses on advancing women's health equity by focusing on intimate partner violence and reproductive coercion victimization among women, as well as intimate partner violence and reproductive coercion perpetration among men, really centering on the root causes of health, focusing on social determinants. A bulk of my work is focused on intervention development for men who have caused harm to an intimate partner. And so Chidera and I will share a little bit about that during our time with you. Chidera, would you like to introduce yourself?
Yeah, thank you. My name is Chidera Eja. I'm a first-year MSPH student studying health education and communication through the HBS department at Bloomberg. I have the pleasure to work with Dr. Nworu. I would say that my research interests mostly lie in maternal and reproductive health, as well as sexual and reproductive justice, and then also just general education, health education, promotion, things like that.
And so one of the projects that we'd like to share with you is about interrupting violence. And so it's a crisis line expansion for men who have caused harm in their intimate relationships. And so we now have an official name for this hotline expansion. It's Gateway to Change, a Path to Peace. And we are collaborating with a longstanding community partner, House of Ruth Maryland. It's the domestic violence agency throughout our state. And the purpose of this project is to understand the acceptability of expanding House of Ruth's existing hotline for survivors, primarily if it's acceptable among their staff, among survivors of violence, as well as potential users, so to speak, of the hotline expansion. So that would be partners at risk of causing harm to their intimate partner, as well as the feasibility of expanding the existing hotline for this population. And so as principal investigator of this study, my role is to secure the funding for the project, to establish the evaluation framework that includes developing the logic model, the program theory, the evaluation metrics, as well as leading the data collection and using the evidence that we've gathered to help develop the expansion. So what that included is the staff training at House of Ruth Maryland. So equipping their hotline advocates with the proper language to address partners who have been abusive or have the potential to become abusive. So we developed an 8-hour training with their team. And also helping to develop the infrastructure. So the social marketing campaign, the infrastructure things at their end, like developing or helping them to implement a second hotline, a website, all of those things. And so it's been a pleasure to have Chidera on board to help as well.
Yeah, just going off of that. So my role mostly is analyzing the qualitative data. I only started a month ago, but I'm very happy to have done the work so far. And specifically the qualitative data that I've been analyzing is the focus groups from the House of Ruth Maryland. So for those that are the victims of intimate partner violence. And I've also been analyzing the data for the House of Ruth Maryland staff meetings. And since then, that data has been used for a report back to the House of Ruth Maryland staff. And then also I'm in the works of creating a literature review for developing best practices for a crisis hotline. And this is very important because there's not a lot of information about crisis hotlines specifically for intimate partner violences. So we're trying to develop, best practices through literature research.
Thanks.
Oh,
go ahead.
sorry, go ahead, Sally.
Oh, are you working as a research assistant, or is this like for a master's essay? Could you talk a little bit about how you got involved?
Yes, I'm so sorry. Yeah, I'm working as a research assistant. But definitely, given that I am a first-year student and I'm going into my practicum, I'm hoping that I get to do something similar as someone who is maybe still a research assistant or maybe a different position, sometime later in my practicum. So for those that are interested, this could definitely be a good practicum position in the future.
Thanks. Dr. Holliday, Waru, did you have something before I interrupted you?
Oh, no.
Okay, great. Well, yeah, thanks so much for talking about this project. I think it's really I have a question about sort of the public health impact, but I think that that is fairly obvious with the description that you've provided so far, and great to hear about work where you're closely collaborating with a community partner. But is there anything else that you would like to say about the public health impact of this work?
Sure. One thing that we've found in conducting focus groups with stakeholders, folks who have experience working with partners who have caused harm, as well as implementing hotlines in various aspects, is that although there are few established hotlines for partners at risk of causing harm, right now in the US, there's currently only one hotline in Massachusetts. It's called A Call for Change. We did find that there are folks doing this work, but as we know with public health, evidence is key. And so we're really excited to be evaluating this work and excited to be able to disseminate it. This is a high impact project funded by the Bloomberg American Health Initiative. And so one of the outcomes of this is to be able to share our findings and hope to inform some of these more informal efforts that are going on to address abusive partners. And then just the additional impact I think that we haven't shared so far is that there are crisis supports for just about anything. We are fortunate to have had the hotline for victims of domestic violence or intimate partner violence to be established after the Violence Against Women Act in the mid-90s. And we know that crisis lines have been around since the 50s or so for suicide prevention and other forms of crisis supports. But there really is a dearth of support, of harm reduction avenues for people at risk of causing harm to an intimate partner, particularly outside of the criminal legal system. And so we're just grateful for this work, and we hope that there's someone on the line that's interested in abuse intervention.
Yeah, and I think to add to that, I know that we're limited on time here, but I think beyond just the impact that it has on the target population of, victims of IPV and as well as their abusers, I think it's also very impactful for individuals like myself. So I have a long-term goal of becoming an OBGYN, and so I think it's provides valuable insight for someone who's interested in clinical practices related to intimate partner violence and reproductive and sexual health, because I think it would help us, develop best practices in the future, as well as just provide overall motivation to help with this general public health issue. So that's my goal, and hopefully anybody else that has any similar goals feels the same.
Thanks a lot for sharing that. It's really great to hear about your long-term career goals and how this will shape that. So thanks again. I'm going to open it up to questions in the audience in just 1 minute. But first, before we get to that, I did want to just invite all 4 of our panelists to maybe share one thing that you really like about either the department or about Baltimore, just to give folks a sense of what Baltimore and the department are like. Anybody want to go first?
I'll hop in. I think regarding the department, my favorite thing really is the people here. It's really a community, and I love that. And I have to share Baltimore too. I came here for training, wasn't very excited about moving to Baltimore, but Baltimore has become home, and I love it here. So if you're on the fence about Baltimore, just give it a try. It really is a great place. People are great here.
I can also piggyback off of that. I recently graduated from George Washington University, so that's in the DC area. So I was in love with DC. I didn't really want to leave, but prior to that, I'm from North Carolina, so I really just loved the big city, and I wasn't too sure, like Dr. Nworu, about Baltimore, but when I did come here, I did really learn to love the city. And I think it just has very much of a homey feel, like a very neighborhood vibe. And there's always something new to try. I'm always discovering something. So definitely, it's good to get out of your comfort zone if you're not used to something similar to Baltimore. But I think overall, you'll just learn to love it eventually.
Thanks.
I can go next.
Yeah.
Mine have already been said, but I want to just echo the people again in the PFRH department. I have made like some of my lifelong friends here. All the faculty are amazing mentors. Just, it's a really great community. And I think that's really unique. The collaborative spirit. And in terms of Baltimore in general, the food scene is phenomenal. So those are my 2.
Ooh, I don't know if I have anything new to add to this, except to really echo. I mean, Baltimore is an amazing place. It is full of art and bustling with just activities and food, and is a really, really, really interesting and wonderful place to be. And in the department, I'm a transplant as well to Baltimore, and I have found that population, family, and reproductive health, it is such a community. It is embracing for faculty, for students alike, and we have just incredible people power. And it's one of the things that I love most about this environment, and actually brings me physically in every day. As soon as we were able to come back in after COVID, I thought, oh, I've got to get in so I can. We were just saying this morning about how wonderful it is to be able to spend some face time and really see your people and be part of that physical community. And it's one of the things that I just love about being here. So and hope you're able to catch that even in this virtual session. Thanks.
Thanks so much. So with that, would love to welcome questions from the audience. And I think we've just heard how approachable everybody is. So please, we would love to hear what your questions are about what you've heard so far today. Again, we'll get to specific degree programs and like application process in a minute. But if anybody has questions about the work that our panelists have talked about, we'd love to discuss for a little bit longer. Any questions? All right, well, I won't force it, but any final comments from our presenters today?
I think I'll just share that if questions do arise, we're all available. You can find us on our faculty websites as well as LinkedIn if you just Google our name.
Thanks
Hi,
so
everyone.
much. Thanks.
You got a question?
Oh, Ryan,
Do we-
yes. Yeah, go ahead, please.
Okay, so do we have to type it or we can speak out the
No,
question?
we can hear you. Go ahead.
Hi, everyone. Thanks for the presentation. I'm Dr. Ryan. I'm a resident doctor in Nigeria, currently doing a master's in maternal and child health in the UK. So I wanted to find out if there are PhD opportunities in maternal and child health. That's my core area of interest, maternal, neonatal, and child health.
Yes, and we can talk about that as well in a little bit when we talk about specific degree programs, but we definitely do have PhD students who are engaged with faculty here in the department in similar ways to what our master's students have presented today, and able to work with faculty mentors on projects, on topics like what we've been discussing today, as well as maternal neonatal health as well. I don't know, and again, we can talk about that when we get into the specific degree programs, but I don't know if any of our panelists want to expand on what I've said or if I covered it. Yeah, so, and Dr. Ryan, we did have a virtual info session earlier this year. I think it was in November, and we had a student panelist who is a PhD student. And so if you wanted to hear more about a specific project, we could provide the link to that info session as well. Any other questions from the audience? All right. Well, if not, I will let our panelists go on with their day, but I'll continue sharing information to all of the prospective students who are here about more about our degree programs and application requirements and things like that. But just huge thanks to our presenters for joining us today. We really appreciate you taking the time to share with us your amazing work. So thanks so much, and feel free to hop off.
Thank you, Sally. Take care, everyone.
Thanks.
Thank you.
All right, so I'm going to go back to sharing my slides. Thanks, Mary Alice, for putting the link in the chat to the virtual info session. So let me go back to my slides just one second. All right. Like I said, as a reminder, PFRH is just one of 10 departments at the Bloomberg School of Public Health. And so I'm going to talk about our some of the degree programs that we have here in the department, but keep in mind that there are master's and PhD programs in other departments in the school, as well as school-wide programs that aren't housed in a specific department, such as the DRPH program and the MPH program. And so if you have questions about any of those programs, we can talk about them in the Q&A section, but I'm focusing here just on programs that are offered through the department. So the main program that I'm going to focus on right now is the Master of Science in Public Health program. So this is an on-campus full-time program that takes 2 years to complete. But we also have an MHS program that can be completed online on a part-time basis, or we have students who do the MHS program full-time on campus in just 1 year. like I said, we also have a PhD program that's on campus full-time. We do provide 4 years of tuition funding as well as stipend support. And so the PhD program involves about 1.5 years of coursework and then about 2.5 years or so of proposal and dissertation work. And so the PhD program application is closed. That closed December 1st, but the application is still open for MSPH and MHS programs if you're interested in applying for an August start. I'm not sure if we have any Hopkins undergraduates on the call right now, but I also want to promote our accelerated bachelor's MSPH program. And so this opportunity is available specifically for Hopkins undergraduates. And it is a full-time program on campus. You, similar to the MSPH, you would complete a year of coursework, and we'll talk about that in just a minute. But you do have the opportunity to complete the degree one term early. So our bachelor's MSPH students who are graduating this year have actually already completed coursework. They finished in earlier this spring and are ready to graduate in May and not taking courses. So you do have the opportunity to have some credits transfer from your undergraduate degree. So a little bit more details about the MSPH. This gives you an idea of some of the coursework that's involved in that program. The coursework really focuses on the life course framework that I mentioned at the very beginning of this presentation, population health, demographic methods, as well as courses that are in the PFRH areas of interest. So you would take courses depending on whether you're focusing on child and adolescent health, women's sexual reproductive health, or one of the other areas of interest. Students also complete a field placement and a master's essay. So again, that first year is really focused on coursework, and you fulfill some requirements before you're eligible to start the field placement practicum. And then in the summer and fall of your second year, you engage in the field placement, and we can talk more about that if people have questions. And then students come back in the spring to take courses and also complete a master's essay and present. And so Olivia, who you heard from today, was talking about the work that she's done for her master's essay, but she, I think, also did at least some of her field placement with Dr. Decker. So often those two experiences, the field placement and the master's essay, might relate to each other. Again, for those Hopkins undergraduates who might be here today, I want to emphasize that you have the opportunity to complete the MSPH on an accelerated timeline. And so students in this combined bachelor's MSPH program can finish a term early using 16 credits that you transfer from undergrad. If you are interested in that accelerated program, you would have the opportunity to start the master's essay a little bit early. So where most of our students do the master's essay in the spring, our bachelor's MSPH students can start that earlier in the fall, and again, complete courses earlier in the spring of their second year. However, students in the accelerated program certainly have the option to stay in the program for the full 2 years and take 2 full years of courses if they would like. Like I mentioned, we also have an MHS program. This can be completed in 1 year on a full-time basis. A lot of the coursework is the same, but the MHS focuses a bit more on research. And so there are some research competencies that our MHS students complete. And then MHS students don't do a field placement, but they do a master's essay similar to what our MSPH students do. Again, the MHS could be completed on a part-time online basis if that works better for you. But some of our full-time students do complete this program in 1 year. Dr. Decker mentioned the gender certificate when she was presenting earlier in this session. I do want to mention that students have an opportunity to complete certificates when they are also completing degrees here at the school. So there are some listed on this slide that are sponsored or co-sponsored by PFRH, but there are so many certificate options available to you offered by other departments. And this is a really nice way to find elective courses to take and also have an official note on your transcript indicating that you have earned a certificate and have specific skills or knowledge MSPH in certain areas. So you might get you could do a certificate in biostats or a certificate in program evaluation, and that would be noted on your transcript. Not required to do a certificate, but that is an option. And then some of these certificates are also available to students who are not enrolled in a degree program. And if you just want to take a few courses here, some of these certificates can be earned at your own pace outside of a degree program. I'd also like to mention that our degree programs in PFRH are STEM designated, both our master's and PhD program. And so if you are an international student, this has some benefits in terms of extending your eligibility to work through OPT. Like I said, our PhD program application is closed, but our MSPH and MHS applications are still open. We do encourage you to apply as early as possible. We make decisions on a rolling basis. If you're an international student, we highly recommend that you apply by May 1st in order to have time for the visa application, but the application does remain open for the programs until June 1st. If you're interested in that bachelor's MSPH program, if you're a Hopkins undergraduate, you can apply by July 1st between your junior and senior year. And we can talk more about that if people have questions. You can apply through SOFAS for our master's programs, and we require a personal statement and a resume, some letters of recommendation, and all of your official transcripts. If you are interested in the bachelor's MSPH program, the application is a little bit simplified. You complete the SOFAS Express application. For our international applicants, we do require a test demonstrating proficiency in English. And you're welcome to submit GRE scores, but they are optional. I'm going to stop sharing my screen to see what questions you all have, but before I do that, want to emphasize that you can please stay connected with us. We have both Kristen and Gilbert online who will help respond to questions, and we hope that you follow us on social media and you can see what our students and faculty are up to through Instagram, X, Blue Sky, and LinkedIn. So I'm going to stop sharing my screen and see what questions you all have. I think I am seeing some questions in the chat, but anybody want to come off mute and ask a question? All right. I'm seeing a question about internship programs. So you're an MPH student and currently working on maternal health. So are you still here, Dr. Arya? Are you an MPH student here at the school, or are you somewhere else?
Hello.
Hi, yes.
Hi, I'm an MPH student from India.
Are you, okay, great. Are you at Hopkins or are you at an institution in India?
I am currently from India. I'm doing MPH from India, from a
Okay.
national institute.
Okay, great. So I think if you're in a Hopkins degree program, you are always welcome to reach out to faculty here doing work, and like our MPH students, our MSPH students are able to collaborate with faculty on their master's essay. Many of our MSPH students in the PFRH department complete their field placement with faculty here at Hopkins. So that is an option. If you're not a currently enrolled student, it might be a little bit more difficult to get in touch with faculty, but you're certainly welcome to reach out. And I will put a link to the faculty directory in the chat right now so that you can, you know how to find people. And Dr. Holiday Waru mentioned this as well, that you can find people through the directory and contact them.
Thank you.
Thanks. I see a question about the DRPH program and tuition. So the DRPH program is an online program. We do have a concentration in women's and reproductive health, and we have a lot of really amazing students in that program. But the DRPH program is an online program, and so tuition will vary depending on the number of credits that you take. But I will find I will find the link to the school's tuition rates. If you're a full-time student, you pay just one flat rate. If you're a part-time student, you pay by credit up to 11 credits. So I can put the link in the chat to that info. Yeah, and so I know we didn't talk much about the PhD program today. That's partly because that application period has closed. But if you have specific questions about the PhD program, we're happy to talk about that. I think Gilbert mentioned in the chat that the application for the PhD program will, and as well as master's programs for the next cycle, will open later this fall. The application deadline for the PhD program is December 1st. But let us know if you have more specific questions about the PhD program. I see the question, you're interested in the MPH. So Johns Hopkins School of Public Health does offer the MPH program as well. The MPH is a school-wide program, so again, not housed in a specific department, but if you were to concentrate in child and adolescent health or women's and reproductive health, you would certainly interact a lot with faculty in the department and have a cohort of other students in that concentration and work with those students and faculty. For the MPH program here at Hopkins, that program does require 2 years of work experience. And so depending on if that is a good fit for you, you can apply, and the MPH can be completed either here on a full-time basis or online, and you can do that part-time. And Mary Alice, thanks Mary Alice, put in the chat the link to search for all of the many programs here. And I see Manjushri, you have a question. Would you like to come off of mute?
Yeah, hi, you can call me Manju. So I'm from India and I'm a OBGYN. So with almost more than almost decades clinical experience, and now I'm into clinical research completely. So I work with the industry, and so I wanted to know, like, I'm interested in the PhD program. So I wanted to know, for international students, do we get in touch with the faculty, and do we work before? Because PhD is a major degree program, as you know, it's the ultimate degree program. So do we have the need to we be working as a postdoctoral research fellow before applying for PhD, or how does it work? I specifically want some information regarding that.
So is your question about whether you need research experience in order to apply, or is your question whether you need to reach out to faculty here to figure out who you're going to work with?
To the faculty, because I'll probably have to have a strong case with the faculty to be accepted for a PhD. So should I be working initially as a postdoctoral research fellow, if it is possible in the department, and then apply for PhD? Is my question.
Yeah, so you're welcome to reach out to faculty, and like I said, you can search through the faculty directory. You want to make sure that there are faculty here who closely align with your interests and have the expertise that you want them to have in order to get the training that you are looking for. But we do not expect that our applicants would have pre-existing working relationships with any faculty here, and so you apply and you talk about your interests and you maybe talk about faculty, but there's no expectation that you would have contacted faculty or worked with them, because we do the matchmaking process with advisors once you're admitted and accept the offer, and that's totally fine. Is that helpful?
Yes, I just have one more question, if you don't mind.
Yeah.
So, for the MSPH tuition fees, does JHU provide complete scholarships, or how does it work? I mean, for the tuition fees, does JHU provide more than 50% of the scholarship? How does it work? I really wanted to know.
Sure. So for the MSPH program, any MSPH student who is in good academic standing receives a 75% scholarship during the second year of the program. So for students, you would expect to pay the full-time tuition in your first year on your own. And then in that second year, again, the school provides a 75% tuition scholarship for anybody, for students who are in good academic standing. Some of our students have an option to take like 25% in year one and then just go down to 50% in year two. So that's an option. But when you're doing the math, it covers 75% in the second year. We do have other scholarships that are available either through the department or through the school. And so if for department scholarships, when you apply, we automatically consider you for those scholarships. And so with those scholarships, sometimes we're looking for people whose area of interest is on a certain topic. We're definitely looking for our strongest applicants who have excelled academically in their undergraduate program, but you don't need to apply separately for those scholarships. Again, you're automatically considered for those, and we would let you know if you receive the scholarship once you're admitted. We also have a school-wide scholarship that provides up to 50% support in year one. And that scholarship is geared toward, again, our applicants who have excelled academically as an undergraduate, as well as students who are first generation college students, and we do consider financial need in order to be eligible for that scholarship. So if you're interested in that scholarship, when you apply, you would send a little bit, you would send some extra information about your financial eligibility. It's called a CSS profile, and then you are in the running for that scholarship. So I hope that helps. I'll try to put in more information about the MSPH program and the scholarships in the chat.
Thank you so much for the information. And I hope I can find the tuition fees and everything on the website for MSPH and the requirements for PhD on the website. I have gone through the PhD requirements actually, but MSPH is something I have not gone through. So I hope it's available on the website.
So I put a link in the chat to the information about tuition. And so for the MSPH program, like I said, that's a full-time degree program. So you would, on that website includes the cost for full-time students. Let me see if I can find some information on the website. If you look in the frequently asked questions for the MSPH, there's some info about scholarships there that I just went through. Oh, and Mary Alice also.
Yeah, I just saw the link. Thank you so much. Thank you for your patience and time. Thanks a lot.
Yeah, thanks for coming today. Yes, I see a hand raise at Asopo. Sorry if I'm mispronouncing your name. Do you want to come off of mute? Yes, we can hear you.
Okay, yeah. Thanks so much for the information. So I just want to ask a question about the CSS board. I have filled it. I have submitted every financial statement I've been asked to. So I just want to know, like, for applicants who filled in for 2025, 2026, how soon will they get a response from them? Then also, if an applicant is thinking of deferring his admission to 2026, will he or she still be considered for the CSS board scholarship? Thank you.
Thanks. Thanks for your questions about the need-based scholarship for the MSPH program. And I see a similar question in the chat about the MSPH scholarship. So let me start with the second question. If you defer admission this year, you would, whether or not you've been offered the need-based scholarship, that applies to this year only. So if you deferred admission, you would need to reapply for the need-based scholarship. You would need to give us information again about the need-based scholarship. And even if you are offered it this year, it does not guarantee it for next year. I think that you and the person in the chat is asking about the need-based scholarship and when you find out that you received it. So we've been able to notify some applicants that you have received the need-based scholarship. You would have heard from us already. If you have not heard, that means we might still be able to offer additional scholarships, but we don't know at this point. So essentially, people who qualify, we go through those who qualify and we nominate our strongest applicants for that scholarship. And then there's a school level committee that decides who will be awarded the scholarship and makes those final decisions. So that's kind of out of our hands. And at this point, again, we've made some offers, but there is potential that more people will be offered. But even those who we've nominated are on a wait list at this point. And so we basically are waiting for people who had that initial offer to either accept or reject our offer. If we have people who reject the offer, then we might have more spaces on that need-based scholarship open up, and we would notify you as soon as we can. I expect that there might be some offers made around April 15th as other people are making the decision deadline, but the information might come a little bit later. So again, it's sort of a waitlist situation at this point. We hope to be able to make more offers, but nothing guaranteed at this point.
So, sorry, thanks so much for the answer. This is more like a follow-up question. So, for someone like me, would you advise I wait till I get a response from them before filling out the deferral form, or what would you do? Because I'm currently waiting for the response, and at the same time, I don't want to take chances, and I just want to be able to like make my choice. Of course, I've accepted the admission, but I just want to be sure if I'll be considered for the CSS. If not, should I go ahead filling the deferral form, or I should just hold on to get a response from them? What would you advise me to do?
Yeah, so if you want to reach out to me, I could see if I could look into your specific case and see if you're eligible for the scholarship. I might be able to give you a little bit more info. I'll put my name in the chat. I know it's a hard decision whether or not to accept the offer without knowing that scholarship. I think it's an individual decision. I would be happy to talk more about your specific circumstances. All I can say is that we hope to let people know about that scholarship as soon as possible. But again, at this point, people are essentially kind of on a wait list, and I'm not sure that you would know before April 15th. But if you want to talk more about your specific circumstances, we could talk over email. Great. And hi, Emma, I see your question that you have filled out the CSS profile and whether it is the same. I am not sure if that info stays on record. Again, I think my recommendation here is to reach out to me, and we could ask the school if your info is on file. Have you already applied, or are you considering like applying for the accelerated program? You don't have to share your specific info right now, but I think it might be beneficial to talk more about your individual circumstances a bit further.
Oh, I'm currently considering applying for the accelerated program, and I have
Okay.
filled out the CSS before just as a Hopkins undergrad. So I was just wondering if the information is similar, if it transfers over, if I have to do a new application process.
Yeah, I'm not sure. And for accelerated bachelor's MS PhD students, you would be considered for the need-based scholarship like next cycle. So we wouldn't make that decision for you right now. You would be in the running to find out like next year. So like next spring is when you would figure out if you were going to receive the scholarship. But we could definitely ask the school to confirm whether they have your info on file or if you would need to resubmit if you apply and get to that point.
Thank you so much.
Yeah, thanks. Other questions? It's 12 o'clock right now. And so really appreciate those of you who have joined us today for coming. I hope you enjoyed this session. Understand that people have busy lives and might need to go on and do other things, but I'm happy to stay on for a bit and answer more questions. But Mary Alice, I think we could probably stop recording at this point. So thanks so much, everybody.